Welcome to Triumph, where hope and new life become possible. At all Triumph facilities, we are doing our part to prevent the spread of COVID-19 in order to keep our staff and patients safe. We are following strict policies and protocols to ensure we meet the Department of Health and Yakima Health District standards, which include the usage of personal protective equipment, hand hygiene, and social distancing. Our staff will be available to all patients to offer reminders about how we can assure your health and well-being, such as covering your cough, washing hands, maintaining distance, and monitoring for symptoms. We are mindful of the need to identify, isolate, and communicate these symptoms. Prior to entering one of our residential facilities, you can expect to answer some questions about your health so we can better meet your needs when you arrive. You will answer the same health screening again upon arrival. These questions will ask about symptoms you may be experiencing or maybe recently experienced, including possible exposure incidents. Upon arrival, you will have your temperature taken and be asked the screening questions again. Your stay in our facility will begin with 5 days in stabilization, which will allow for us to monitor your health needs while completing the intake processes. If any concerns arise, you will be referred for prompt medical care while remaining in treatment. If there are no health concerns in those 5 days, you will be transferred to your bed in the facility to enter the rest of the patient population currently in treatment. During these initial 5 days, you will begin the treatment process, but either through telehealth or through minimal contact with others, though our staff will be present 24 hours a day to answer your questions and attend to your needs. As you settle into the routine in stabilization, here are a few tips for your health and safety. You will be provided a surgical mask as often as needed. Once the mask is soiled, please dispose of the mask in a trash can. To wear a surgical mask properly, you will follow these guidelines. Always wash your hands or apply hand sanitizer before touching your mask. Only touch the ear loops, not the face part of the mask. Use a paper towel to place your mask on if you need to put it down before applying it to your face. With the blue side facing away from you, notice the top by locating the firmer edge of the mask. Pull the loops over your ears and then press down on the firm edge of the mask to close any gaps from the top of your nose out under your eyes. Proper hand hygiene is one of the most effective measures we have to prevent the spread of COVID. Please use these guidelines when washing your hands to effectively clean your hands. Turn on the hot water and rinse your hands with warm water. Apply a generous amount of soap and slowly count to 20 while scrubbing all portions of your hands, top and bottom, paying close attention to your nails, knuckles, and the back of your hands and wrists. Rinse under the hot water. Get a paper towel and thoroughly dry your hands. Then use the paper towel to turn off the water prior to throwing the towel away. The Public Health Department has set the definition of an exposure incident as any contact with an infected person without a mask for more than 15 minutes, less than 6 feet apart. For this reason, we have limited the number of patients in each program to allow for single occupancy rooms and the ability to maintain distance in the group and class setting. Patients are screened at admission and daily while in the stabilization phase. If the patient develops symptoms, he or she will be immediately referred for medical attention. This typically involves a call to the primary physician. Triumph continues to offer safe paths to health and hope for our staff and patients. We hope you found this video helpful. If you have further questions about how Triumph is preventing the spread of coronavirus, please contact Teresa Adkisson, Chief Strategy Officer, for more information. 509-248-1800.